welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton, and today we're going to talk about birth defects, which is not necessarily a happy topic, but because we can do a lot to prevent it and reduce it, it's a very important thing to go through. My guest is from the Hampton Health Department, a nurse and educator, Meena Tamakloe. Welcome.
Thank you for having me here.
It sounds, it's a big and bad. It's the scariest thing, really. I think any woman who is pregnant, and I've been through this, I don't know if you've been through this, but
yes,
it's a constant worry about, is my child going to be healthy? Is everything going to turn out okay? We can do some things to influence that outcome.
That's correct. There is a lot to be done for women. Now in the United States, half of the pregnancies are unplanned. So women, most of the time, find out they're pregnant around 6 weeks.
Yeah.
So the
hopefully
recommendation...
if it's really unplanned, they may not even catch on right away. Huh?
Exactly. So, and that's why there are recommendations in place, for women of childbearing age to especially take folic acid. That's 400 micrograms of folic acid every day. So even if you don't plan on becoming pregnant, it's very important that women start taking folic acid every day.
Whenever they're at that point where they're sexually active.
That's
just
correct.
In case.
That's correct.
Because those first 6 weeks are crucial to development.
That's very true, yeah. So they have to be taking that, And if you know for sure that you want to get pregnant, at least you can start a month before you become pregnant, yes.
Well, and it doesn't always happen that fast. Sometimes it takes some of us a while. Birth defects as a whole, how common are they now in this country, in the developed country, versus, 20 years ago, 50 years ago?
So surprisingly, it's still very common.
No,
in the United States.
I feel like we've made big strides.
We have, but it's still common in the United States. Currently, we have about every 4.5 minutes, one baby is born with birth defect, making it at least 1 out of every 33 babies. So, which is still a lot. We still have a long way to go. It is also very costly. Very costly. It costs about over 2.6 billion to for the health, yes, to treat children with birth defects, and it's critical as well because about 1 in every 5 deaths is related to birth defect.
Wow.
That is during the first year of age, which makes it about 20%, really 20% of all infant deaths, not even counting those from age 2 to 14.
Well, now, see, I guess, too, I think of the kind of preventable birth defects that are caused by something that we've identified. So there were drugs that women used to take during pregnancy for nausea or for energy or for whatever that we learned and have done away with. And there's so many things now. If you are pregnant, the doctor will barely prescribe you anything. It's just people are very careful. But there's a lot of birth defects you can't really prevent or control.
That is very true. Now, besides fetal alcohol syndrome,
got control of that one.
That's right. But all the others, really, you cannot tell ahead of time. But at least we know the risk factors. So some of the risk factors are, especially if you're a woman over age 34, you have a high risk.
Yeah, I know. My doctor kept telling me that. It was very scary. Every visit, I'm like, okay, I understand,
That's right.
And we did, tested for some things. Wouldn't have changed my decisions, but it helps you prepare and learn if you know your risk factors.
That's right.
Think.
So for that, for example, that's why for women, there are the screening available for you during the first and second trimester. You can do blood tests, you can do ultrasound, amniocentesis, just to be able to screen and then just do something about it. Other risk factors will be if there is family history. And if there's family history, definitely you want to talk to your doctor about that.
Because you can do a lot of pre-screening and genetic screening before you conceive to make a decision about what the risks for that child are going to be.
That's correct. That's correct. So it's very important, like you said, to do the pre-screening to see what is, what can be done, even though at that point there is really no treatment for it. Pretty
No, but
much
if you
just,
know that you're at a very high risk, you might make a decision, say, to adopt or to do something different that would still allow you to have children that might not be, you might choose not to pass along those
absolutely
genetic
right.
traits.
You're absolutely right. So it's very important because, birth defects, we have different factors. It could be genetic, like you said, or it could be due to environmental factors or behavior, like smoking, alcohol use, drug use. Definitely, those are some of the risk factors that we found.
And we should be able to control those. I know that when there's
yes.
addictions, it is very, very hard to control. And I don't want to judge anybody, but you do have some control.
Definitely.
And can make different choices, shall we say.
That's correct. So that's why education is very important as well.
And that's one of the things the health department does, and that's why you're here, is educating, and I'll say women, but it really should be couples because it takes two, about what the risk factors are and what they can do.
That's correct. So that's our part, responsibility is to educate the public. Because the health department, what it does is to collect, to track the incidence of birth defect, and then use the data to educate the public on how to prevent birth defect. And for the National Birth Defect Prevention Network, they have a goal, and the goal is to making a healthy choice to prevent birth defects. And the action, what has to be done, the action steps to be taken is make a PACT for prevention. So that's an acronym. PACT is planning ahead, meaning that...
Boy, people are not good at planning. Just starting right there, that's a hard thing for a lot of folks to do. As you said, 50% are unplanned?
Yes.
Wow. Okay, so I interrupt you. PACT, P, planning ahead.
Yeah, so planning ahead, definitely making sure you stay healthy, maintaining your weight. Also making sure that you take your the folic acid.
Folic acid is crucial for
multivitamins or
young
prenatal vitamins, 400 micrograms every day.
And it's important, again, before you're pregnant, before you know
That's
you're
right.
pregnant, and if you're trying or if you're not being careful.
That's right. And the A will be avoid harmful substances. So that we say smoking, alcohol use, drug use, and also like fumes, work-related toxic.
Paint fumes and other kinds of toxic fumes.
And then the C will be choose a healthy lifestyle. So staying active, eating healthy, and that means fruits and vegetables, whole grains.
Boy, it always comes back to that, doesn't it? Every time I have someone on this show to talk about disease prevention or treatment or any, it comes back to get some exercise and eat healthy foods. Those two things just increase your chances for health and your child's health almost more than anything else. And yet, most of us aren't very good at it.
That's very difficult. That's right. That's why we have to keep, educating, keep educating. And then the T is to talk to your healthcare providers. So if you're taking any medications, like you said earlier, some medications can cause birth defects. So your doctor has to know what prescription over-the-counter medications that you're taking, so they can advise you on that. Also making sure that you have regular prenatal visits, and that's also very important. Most women, if you don't have, I've met women who don't have insurance, and therefore they are not able to, go for regular prenatal care. So
that is a hard thing for women. I had a young friend who was pregnant, and she did great, but she skated through on some of those appointments because she didn't have money and she didn't have insurance. And what do people like that do?
That's a very important question. Now, of course, if they can qualify for Medicaid, definitely we encourage them to do that, to apply for that. But other than that, we just look around what resources are available, where we can refer these women, to get them the help that they need. For WIC, for example, you can get prenatal vitamins. You can get that for free. So even if you cannot not afford it.
So how do you do that, Meena? Tell us.
For WIC. So if you're on WIC.
Okay.
Of
and
course,
as soon as you are pregnant, if you have no resources, you should talk to social services and see what resources are out there.
Definitely. You have to talk to social services. They refer you to all the different services around here. WIC definitely is very important. They should and help you with nutrition aspect, breastfeeding. They give you prenatal vitamins, for free that you can take. And of course, Health Department has other programs. If I have the Baby Basics Moms Club, which is just a prenatal class, free prenatal class, comes with other incentives that moms get. And again, we educate them about birth defects, smoking cessation, and a whole lot of other things that they need to know to stay healthy, to be able to have healthy pregnancies and healthy babies.
Well, and I think, too, that connection it's as important as the information, because if you are young and pregnant and maybe not in a stable relationship, you don't have those resources maybe in your own immediate family or circle of friends, you can get them through the programs the Health Department and social services offer. And so you maybe feel a little less alone.
That's correct. That's correct. So there is help. There is help, like you said. If you don't know, just pick up the phone and call Health Department and find out, what is available.
Okay, so call social services, call that. So instead of the T just being talk to your doctor, I'm also going to say talk to your community resources.
That's correct.
And reach out, and you can ignore something, but it's not going to go away. You're going to have that baby, and you want to do what you can to protect that baby, whether you're going to keep it or, whether it's you need to go for other resources or for adoption, you still want that healthy outcome.
Yeah. That's correct. You still want that healthy outcome because it changes the whole family dynamic if you have a child with birth defect.
Yes.
For a mom, maybe you have to stop work, and that's going to affect finances in a home. So it's a whole lot. But if something can be done about it, most definitely. I think we encourage women to take that action now and do what they're supposed to do, by especially taking their folic acid as early as possible. Yeah.
Okay. Well, thank you, Meena. Is there anything that I've forgotten to ask you that you want to add?
I think the only other thing I will add is the diabetes is the other thing that has been found. So obesity and diabetes, to be able to control that, because that has also been found too.
So those sugar spikes would affect the baby's development as well as. Okay.
Yes.
So if you have diabetes, you can't get rid of it that quickly. You can eat healthier and you can make more exercise, but you just need to make sure that your sugar levels are stable and that you're being treated for that condition as well.
Definitely management, keeping it under control, keeping a healthy weight. It goes back to maintaining a healthy weight.
It does go back to that, unfortunately.
That's right.
Okay, well, thank you, Meena. I appreciate it.
Thank you very much for having me.
And thank you for watching. I hope you've learned a little bit. Birth defects are very complicated, but there are some things that you, if you are pregnant or of childbearing age, can do to increase your odds of having a healthy baby. Thanks for watching.